Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with Kaleida Health on 96.5 FM, WUFO 1080 AM, or you might be streaming, which is something probably 12 years ago or 15 years ago, we didn't have streaming. So I just want to say welcome to the Great Lakes Health Radio program with Kaleida Health. My name is Francesca Messiah, Manager, Community Health Improvement. And I just want to say, I've been looking at our website with all of the sites and all of the services we have. So if you're interested, because I'm going to run through it really fast, our website, just Google or any search engine, you can put www.kaleidahealth.org. Again, that's KALEIDA Health, HEALTH, all one word, .org. However, I always just like to mention a little bit about what's on our website and who we are, because we have hospitals. When you go to our hospitals, Buffalo General Medical Center, Golisano Children's Hospital, Millard Fillmore Suburban, what's unique about that is that if you're going to the ER, it has the wait times, how long you're expected to wait. Not guaranteed, but giving you an idea. Also, our sites include Gates Vascular Institute, DeGraff Medical Park, DeGraff ER Department, Visiting Nursing Association, which makes home visits all ages, 24 hours, 7 days a week. High Point, that's long-term care. DeGraff, long-term care. And we also have hospitals in Bradford and Olean. We have plenty of services in the South Towns. We have blood draws. We have outpatient centers, again, in the north of the city, south of the city. In Buffalo, we have about 6 school-based health centers. But I just want you to, again, visit www.kaleidahealth.org for everything I just mentioned. Plus, if you're interested in working for Kaleida, you can also look for the employment information. Thank you. On with our show. Well, today, everyone knows one of my favorite topics is wellness. So this morning we have Dr. Christine Adams. Good morning, Dr. Adams. How are you?
Good morning. I'm great and happy to be here with you.
Yes, and welcome to the show. You know what? Good thing I'm not a betting woman because I would have bet you have been in the show before, but this is your first time, correct?
It sure is. Yeah.
Yeah. Oh, great. Welcome. And Dr. Adams is the Chief Wellness Officer at Kaleida Health and Clinical Assistant Professor, Wellness Director, and Professional Coach, part of UBMD Emergency Medicine. So to me, when I hear that we're working in the emergency medicine, she has a lot of energy.
Yeah, for sure.
So and our topic for today is employee wellness and daily wellness, because I always like to not only talk about the things we do at Kaleida. I also want to make sure that you, the listener, understand how it connects to what you're doing every day. So, Dr. Adams, could you please briefly describe what is a chief wellness officer, and did hospitals always have this position?
Yeah, that's a great question. So a chief wellness officer really concentrates on the well-being of the people in the organization. It wasn't really popular first at the first iteration of this position, really started kind of in the corporate world. And I would say in the early 2000s, it was definitely something more prevalent in business and the corporate world. And hospitals started to integrate it, really some progressive programs in California, Stanford in particular, around 2017. And the idea is to focus on the well-being of your people, but not just considering the individual human well-being, but looking at the whole organization, kind of looking at the structure of that business or corporation and how that affects the well-being and performance of your people. And a lot of the initiatives came from quality, actually looking at the things within the system that affected quality, and they recognized that taking care of your people will actually affect the productivity and the quality of your organization. So yeah, so it is kind of newer to medicine, if you will, in terms of gaining traction in the C-suite, right? And so the executive level, and to be honest, at now, so I said progressively pre-pandemic, it started in California, and then other organizations definitely, once the pandemic came, really realized that this is an operational process that really benefits everyone in that whole organization. So really in the early 2000s, it started to spread more in healthcare systems. But I have to say that the only two hospital organizations in Buffalo who have chief wellness officers named are Kaleida and Roswell. So interesting piece of trivia.
Interesting. And really, it isn't far fetched from what you do at home. I mean, quality, talking about quality of taking care of a family. So it doesn't matter if you're in a whatever kind of family you're in, but it's all
Yeah,
about quality, taking care of children, taking care of the elderly, taking care of your pets.
yes,
And don't you want that quality, and then that quality then, makes for a healthier pet, a healthier elder, a healthier adult, a healthier child. So it's really taking this big system, which has
right.
over what, 13, 15,000 people, and making
Yes.
sure they're all doing well. So, okay, I get it.
Yeah,
I get
yeah.
it.
And really, the chief wellness officer considers all components of it, right? It's not just the human component, but what else in the system, what else in the organization is affecting those humans, right? So
Right.
it's not just your personal well-being and your personal wellness strategies. What else can we do in the organization to help support that? So absolutely, you should do that at home as well, right? It's not just
Yeah,
what you can do
exactly.
personally. What else can you do in your environment to keep your environment healthy to support your wellness
Absolutely.
journey?
Absolutely. So then, and leading and along that line, how does your work impact that of the employees, and why is it important? And listeners, I asked that question because remember, hospitals, we are open 24 hours a day, 7 days a week. There are
Yeah,
people who work part-time. There are people who work full-time. There are people who work double shifts. So when you take that into consideration, how does your work impact the health of employees, and why is it important?
yeah. That's also really important to kind of publicize is that the fact that this role was created in Kaleida helps to let people know that their well-being is a priority, that it's on the agenda. In my role, I go to those meetings where we're talking about the organizational things, but the bottom line of it is, and we have a wellness committee, we have a team, and the priority, the mission is taking care of the people who take care of our patients, right? We show up, just like you said, we're 24/7, 365. We show up all the time, right? We never close. It is intense. It can be high stress. It's literally people's lives in our hands, right? So you've got to take care of the people who are doing that vital work. So in creating this position and creating these initiatives, the impact on our people is we recognize this is important, right? And this is something that we are building. This is something that we are working on creating to support them so they can keep showing up and take care of our patients.
Yeah. Oh, thank you. Yeah, because taking care of employees goes hand in hand with your loved ones who are
Hmm.
in one of these many facilities that I just mentioned, or they don't have to be in a facility. They could just be drawing blood. And you want to make sure that the health of that employee if it's drawing blood, surgery, helping you with your meal. You just want to make sure, or bringing your meal to your room. You want to make sure that we are healthy
Yeah.
because then we feel better. Something that I think that made me look around and say, was when you had employee wellness days. I know that as part of community health improvement, I participated in the one at the Buffalo General Medical Center, Golisano Children's Hospital, and Millard Fillmore Suburban. Talk a little bit about employee wellness days. And was that the first time we've ever had this?
Yeah, yeah. So that one at Buffalo General was our first day. And actually, there's a unit practice council of nurses at Suburban who this was their second iteration. They just started it. And this is really grassroots, right? We're just starting to build this. And the goal of it is to collect our resources to kind of gather them in one place so we can showcase them to our people. And there's a lot of resources we have which haven't really been named to as supporting wellness or their people's well-being. But when you really sit down and look at what they are, absolutely they're supporting our people's well-being. So the goal of these days are to just start to recognize them, kind of get them all in one room and say, hey, look at what we're doing, look at the resources. Did you even know we have this in our community? Because there's a lot of times we have many mechanisms of communication. This is one of them too, right? We've got it in electronic form, we've got them word of mouth, radio, TV, however it is, but they're not always accessible to everyone, right? Not everyone has access to a desktop even when they're physically at work. So the goal was to just make one more opportunity to showcase the resources that we have and share them with our people. And so having those days, again, this was kind of grassroots, the beginning of it, and we hope to keep growing them and publicizing them and sharing them with people just to increase awareness, to let people know what we have to support them and what's going on.
And you might be listening and saying, "Wow, I wish I had some of those resources. I wish I had some of those informations. I wish my family had this information." Well, I'm just going to make a little plug for Juneteenth Festival because this program I know will be airing before that. But I just want to make sure you look for the ECMC, Erie County Medical Center, and the Kalida Health Wellness Pavilion, which is near the bandstand. And a lot of the information that we're talking about right now on the program about employee wellness, we will be sharing that same information with you, our listeners. So please stop by the tent. How about data? I have to admit, a few years back, I wasn't as convinced on data. I'm a data. I'm convinced now that data has a lot of validity to it. Is there any data that indicates the health of employees and patient care?
Absolutely, absolutely. There's data in a kind of local survey driven data, but there's also national data where they measure the impact. And again, this comes from quality, right? There's a lot of quality data on measuring the impact of stress, burnout, of fatigue, moral injury is another common topic that people are talking about now, and how that has an impact on healthcare workers and then ultimately on patient results, outcomes, and safety. And they find that, and there is data to support that when healthcare workers are experiencing stress or burnout, there's an increase in medication errors. There's an increase, right? When you're stressed and you're fatigued, that disrupts your executive functioning, right? What's executive functioning? It's your ability to make critical decisions, right? And we just talked about how we're 24/7, 365. We show up all
Yes.
the time. We're working all the time, right? There's no real break in the practice of medicine, right? You never know
Um,
what's going to happen. Speaking from the person who works in the emergency department, right? You never know what's
yes.
coming through the door. So if you're feeling this fatigue, if you have this disruption in your executive functioning, there's a higher risk of making errors or not being able to make those quick critical decisions, right? Where you're not as aware of your surrounding. There's also data which shows that people maybe have less adherence to the infection control protocols, right? Because you're tired, you're rushing, you're, distracted. So there is data that supports these medical errors, their increased infection rates. There's data that supports that. And these are the National Academy of Medicine. There's journals of patient safety that do this research and can support that. There's other data. Again, National Academy of Medicine is a big one who talks about staffing ratios, right? When you don't have adequate staffing, how that increases stress and risk for the patient. So again, correlating with quality, the quality of care you're able to give when your staffing ratios are not adequate. And again, kind of going along that line, if you're stretched real thin and you can't give as much attention to your patients, then the patient experience data comes into play, right? How patients feel that they're cared for. That data shows up a ton too. So the more people are stressed, the more burnout they have, the potential for mistake, the less quality care they're giving to their patients, the less quality experience that patient is having. That also shows up in data. There's also data and turnover, right? If you can't staff well, if you can't support your people, they're stressed and turn out. There's numerical data on how much it costs a hospital to replace a nurse or to replace a
Really?
doctor. Oh yeah. There is you can find these data, and there's several studies in each of those, several to dozens in each of those topics that you can look up. It takes tens of thousands of dollars to replace one single nurse. It can take up hundreds of $1,000s, depending on where you work, up to $1 million to replace a highly specialized physician that you lose to stress or burnout, right? So there's a financial implication. There's also data that supports, and this is kind of in the HR world, data that supports call-in rates, right? So if you have increased stress and burnout in your staff, you have increased sick calls, whether it be that they're physically sick or mentally unwell, they have increased call-ins, right? So that also results in a financial implication. So there's a lot of entities. Yeah, there's a lot of entities you can go to find the research where there's actual hard numbers that show either in quality, in patient outcomes, and then the financial implications of not supporting your workers.
And I'm sure in our long-term care settings, our CNAs and LPNs, I'm sure there's data for everything, environmental
Yep.
workers, all of them.
Yep.
Yeah.
Correct.
So employees are our community. Years ago there was a expression that went a educated consumer, blah blah blah. I can't say it because it may not be able to because it's exactly from a commercial. But I always say employees are our community, kind of what you were just talking about. Therefore,
Yes.
how important is it for our employees to take this seriously, to exercise and let's say minimum exercise and adopt healthy eating habits? You may not
Yeah.
have time to go to a gym because a gym might be closed or a
Yeah.
gym may not even open. Or you can say,
Yeah.
what are some things that our employees who are our community,
Yeah.
and our community means from Buffalo to Williamsville to Hamburg to Olean to Bradford. So how can our employees exercise? What are some simple things they can do? And also just to adopt a healthy eating habits, especially when they're working double shifts and all those other kind of hours that are part of a hospital.
Oh, yeah. Yeah. I love this idea because people don't really think about um, kind of training and prepping your body to come to work, right? So the thing that I like to tell people, whether it be in a wellness conversation or coaching conversation, is you can't give what you don't have, right? If you're running on fumes, you cannot give to your utmost potential, right? You can't give what you don't have. So, how do you fuel yourself, whether it be physical or mental, fueling your body? It's like the concept when you get on the plane, put on your mask first before you help
Yes.
others. Right? It's the same thing in terms of physical and mental well being to come to work, to do our job, right? Which we said several times already. It's 24/7, 365. We never close and we don't shut down. We don't have office hours in the hospital, right? And many of our facilities that work night shifts and work all of the time. So I like to tell people is consider yourself like an elite athlete, right? You're coming into work in healthcare and you've got to be on. You've got to be on your game, right? These even professional athletes, they don't show up and just wing it. They don't show up without sleep. They don't show up without eating properly, right? So if you consider yourself a high performance athlete, consider yourself a high performance employee, what can you do to support your body so you can show up and do this high intensity, stressful work? So yes, eating healthy, if I don't bring healthy foods, right? So proteins, healthy fats, right? Nuts are something that I like to do. And I'm hitting up the vending machine. And then you know what's going to happen? I'm going to get that post sugar crash, right? So really putting in the thought, doing a little planning, those are great tricks. And I know a lot of the Kaleida facilities have those Thrive markets now. They're kind of self-serve and they have healthy options. So those are really important, but I like to bring it from home. That helps you, you're saving money, you made healthier choices and you're bringing it with you. And I completely agree with, I go to the gym when I don't have to go to work, and on those work days it's very hard. So what can you do, little tiny micro habits to build in some physical activity? Can you park farther away? Can you take the stairs in between? Can you walk? I'll do sometimes laps around the emergency department if I've been sitting for a long time,
Mhm.
getting up and just doing a lap. And I make it a little bit of a socialization. I make it a little bit of rounding on my patients, but I'm also moving my body, right? Walking back and forth and kind of doing things like that. So it's trying to make the best of any circumstance. You have got to consider it, right?
Yeah,
Like, how can I get my body to show up?
and I just thought about our security guards who are
Yep.
there again, double shifts. I don't know if there's such a thing as triple shifts, but they're always on their feet. Now, most of the time they're on their feet, or they're behind one of the or they're answering questions about where your loved one is, what room they're in. But again, and my favorite go-to snack is an apple. I have an apple core that many times if you go to any grocery store, the apple core is sold around the apples. And mine is white. It takes a little, I call it person power, not manpower. It takes a little person power to push that core through. But it gives you perfect sliced apples. And then from there, I take those and cut those in half. So I'm not choking. And it gives you a little hydration. It gives you the sugar from the apple and it has fiber. So it's just all of those good things. We don't have many minutes left. And what so not only are any tips, but is there anything you would like to cover that we haven't discussed?
Yeah. I mean, I feel like something that's very important for people, especially shift workers in healthcare, don't forget to prioritize your sleep, right? Like this is a little bit of you can't give what you don't have, right? And if it comes down to burning the wick from both ends or trying to fit in a workout, sometimes sleep is more important than that, right? If there's a lot of benefit to your body in recovery from that stress, whether it's standing, running, sitting, hustling around, or just the stress of having that intense shift that maybe was more mentally stressful or emotionally stressful. Sleep allows for a lot of that recovery. So prioritizing sleep is definitely needs to move up most healthcare workers' lists. And I think all humans in general, sleep hygiene is something you can use any search engine to look up. We're not great at that. And it's everyone will benefit from better sleep. We talked about physical activity, eating healthy snacks. Sometimes the other thing that I love to talk about in healthcare is what helps you decompress from your high stress healthcare environment and making that a ritual, right? If it's a playlist to leave work, if it's a physical or a literal or symbolic mantra, something that you can do to help you decompress when you come home. Think about, for some of us who are on the older side, Mr. Rogers, right? He came in, Elizabeth, he changed out of his suit and his business shoes to his cardigan and his tennis shoes, right? That was a boundary ritual. He left work and he came into his happy space and he physically changed his clothes. So I love to tell people in healthcare to do that. What is your boundary ritual to decompress you from that work environment, to help get you in the space where now you're de-escalating, you're decompressing, and you can get into that recovery, regeneration, regrouping after that. I love to suggest that.
Well, you know what? I already have a part two for the show where we will talk about sleep, because in all my years we've never talked about sleep. And
Yeah.
I can tell you, yesterday I found I was so tired because I had an allergic reaction. I always have a very allergic reaction, but to when I was outside cutting the grass, and I took 1.5 generic Benadryl because when I went to bed, I could tell this whatever it was getting larger on my face. And
Yeah.
but I was so sleepy all day. What did I do at work? I was eating. I was eating
Yeah.
chips. I
Yeah.
was eating cookies. I had my salad, but I said to myself, you are eating because
Yeah.
you're tired.
Yes.
And we've never ever talked about sleep, the importance of sleep, and how
Yeah.
lack of sleep can really mess you up. But
Oh, for
um
sure.
so I already have you down for part two where we will talk about decompression. And also, I don't think I ever caught Mr. Rogers from the beginning, so I don't remember him changing from the suit. I just remember
Oh,
seeing him in a sweater.
yeah, you need to look that up now and find
I
it. But he
need
walked through the
to.
door in a suit and he'd hang it up in the closet for
Oh,
sure.
that's so funny. But anyway, um, Dr. Adams, I want to thank you. And this is part one of employee wellness and daily wellness, because there will be a part two on sleep and decompress after a high stress day, which talks about healthcare, but really it applies to most of our lives. So I want to thank you so much, Dr. Christy Adams, Chief Wellness Officer at Kaleida Health, for being our guest this morning on the Great Lakes Health Program. And listeners, in about another 10 seconds, we'll have part two. So please leave this on your dial. Do not change your dial. And Francesca Messiah, Kaleida Health Manager, Community Health Improvement, will be right back. And now on to part two. Good morning, good morning, good morning, and welcome back to the Great Lakes Health Radio program here on Power 96.5 FM, 1080 AM WUFO. However, you might be streaming. My name is Francesca Messiah, if you're just now tuning in, and I'm the manager of Community Health Improvement here at Kaleida Health. Today's topic, we are talking about not only about community health, the Community Health Improvement Department, we're also talking about a new initiative we have for our employees at Kaleida Health, because we know Kaleida Health is great, great place to work. Our guest for today is Vicki Landis, and Vicki is a nurse by trade, but also has her MBA. And Vicki is the Vice President of Community Health Improvement here at Kaleida Health. Good morning, Vicki.
Good morning.
How are you?
I'm good. How are you?
Good. Vicki, this is your first time on the show, right?
It is my first time.
But it won't be your last.
Okay.
It's not going to be your last. So let's talk about community health improvement, which is, I have to say, our listeners, it's a department that I work in. It's a new department at Kaleida Health. And why? Why did Kalida, I know you had a lot to do with this department, but why do you feel that this department is needed?
Well, as you know, Kaleida Health is one of the largest healthcare providers in Western New York. And the department was actually created to help us align better with the Community Health Improvement Plan and the different projects that are coordinated through the New York State Department of Health, through the actual county, Erie County Department of Health, that we're trying to implement better projects to improve the health of our community, but also to align better with all of the different programs that Kaleida Health offers, and also whatever is available within our community, so we can bring them together under one umbrella for full transparency.
Well, you mentioned the New York State Department of Health and Erie County Department of Health. Are we doing everything that they're doing, or just components of what they're doing?
We essentially are doing everything that has been written in the Community Needs Assessment Plan that was conducted over a period of time with Erie County Department of Health, Kaleida Health, and Catholic Health. This is the first time we have been collaborating all as one team, so it's a very exciting opportunity and moment for us.
So it's like everybody in the community will be more or less walking in the same steps.
Exactly.
Oh, great. So now, was community input part of when do you know if, when the plans were developed from the Department of Health and Erie County Department of Health, did they use community input like from across the state?
Absolutely. That's actually part of the component that the New York State Department of Health puts out. So when we are working on putting together a community health improvement plan, which happens every 5 years, there's a lot of different pop-ups that happen throughout the county. There's a lot of input from our people that are living in the community. There's community assessments that are completed by various individuals. And also, like I said, there's different work groups that pop up, and they assess them, they have conversations with them, and that helps drive what the community health improvement plan will be, which is what we're in right now, this new improvement plan.
And listeners, many times if you're out and about, it could be at a health fair or something, you'll see someone from the Department of Health or from Erie County Department of Health asking you a question. That's how these surveys, that's how these plans are developed. So next time someone asks you that question, please don't walk by. just take a minute and answer the questions, because this is what impacts not just our immediate community, but rural communities, right?
Absolutely.
Suburban communities.
Absolutely.
Yeah. So when we say community, we are inclusive of all communities. So then, what are some of the components that Kaleida has selected from the Health and Department of Health, New York State, and Erie County?
So there's four different actually areas that the community health improvement plan and the community needs assessment is focusing on. So first and foremost, they're focusing on food insecurity. And the goal is to increase consistent household food security throughout the whole entire county. The second area is on unemployment. The goal is to reduce unemployment among individuals aged 16 years and older. The third is anxiety and stress, decrease the percentage of adults who experience frequent mental health distress. And then they're also focusing on housing stability and affordability. We also, with Kaleida Health, there are a couple other areas that we're going to be focusing on this year. We're going to continue to focus on colorectal cancer screening and improving those rates. And the other area is on suicide prevention for the adolescent population, something that we have been working on. We received grant funding over a 5-year period from the Office of Mental Health, and there's a lot of focus and energy on that to help reduce that with the adolescent population.
Yeah, thank you. No, those are all really key areas. And I know suicide prevention, that's something, I know initiative we're working on, Kaleida, along with the Near East and West Side Task Force group. And I know we'll hear more about that because that's something coming up in August, working along with a few of the organizations within the Near East and West Side Task Force. Colorectal cancer screening, I know that is just it's prevention, right?
Yes, prevention.
So it's all about prevention. If someone had more questions on that, if someone hasn't had do we have any information like who they can call or?
They really should speak with their primary care provider. The primary care provider is actually the person right in the center helping coordinate all of your healthcare needs, and they can connect you with the proper providers for that support.
Okay, thank you. I know that we're talking about something I want you to brag about your department. And what are some of the areas that when we look at community health improvement, what are some of the areas within this department that people are working on?
That's a great question. So my department is very unique. It's something that I'm very proud of. So in my department, I oversee the birth equity. I have a coordinator that supports that and is out and about throughout all of Western New York doing education with different community partners, doing different pop-up events. If there's a community event, she'll table at that event to talk about birth equity. We're focusing on doulas, and we're also focusing on centering pregnancies, trying to bring people together that are delivering around the same time to provide more of a group education opportunity. It's a really exciting opportunity for people that are pregnant and need that extra support around them. I also oversee the Western Regional Lead Prevention Program. So we do that for all 8 counties of Western New York. And we also provide oversight to the Rochester regional area. We receive funding from the New York State Department of Health. Our focus is on educating providers throughout all of these communities on lead prevention, also on lead testing, so that we can provide those supports to people that have a high lead level, and trying to prevent people from being hospitalized for services that are needed. If they are hospitalized, we provide the coordination from that. And Golisano Children's Hospital is actually the place where the children would come to for the lead, to reduce lead in their system. We have expert providers that are providing that care. I also oversee a YouthLink program, which is a great program. It is focusing on young people between the ages of 13 and 26 that are living with HIV/AIDS or at risk of HIV and AIDS. So it could be a prevention model and also to provide medication treatment, medical treatment. We provide case management and care coordination. There's also a mental health component to that. We do provide pop-ups throughout the community to do education. So if you have anybody in your area or your community that you think that would fall between those ages that may be at risk, please reach out to us. We're happy to help support that. I also oversee community case management. We have 2 different areas of community case management. We are under a health home program. So we provide services under health home program, not to be confused with home care. That is a coordinated case management program, and we do that for the children's up to age 21. And we provide grassroots. Actually, we're in people's houses. We're going to doctor's appointments with them, and we're trying to close those gaps for those people to help them connect to their primary care provider, also work with the school districts, and many other things. And then last, we also do case management. We're doing social determinants of health screening under the 1115 waiver, identifying people that are struggling, and then trying to fill those gaps through interventions that are offered through that program.
Thank you. So you gosh, that's a lot. That is definitely quite a mouthful. And the services are amazing. So YouthLink, I'm just going to start with YouthLink as an example. So if someone feels that their youth might be at risk, I'm just going to be stereotypical, coming in late at night, not saying what they're doing, clothes may look a little disheveled. What should they do when you talk about YouthLink? If that caregiver feels that their loved one, that their young person could be at risk, what would they do? Is there a number to call?
So yeah, if you go to kaleidahealth.org and you Google YouthLink, on there we have a webpage that'll explain more about the program. And you can also read more information about the services that we offer in that program.
Online.
Online.
You know what? And that's something that I started mentioning, I know in the last program. So all of the programs that Vicky has mentioned, when you go to www.kaleidahhealth.org, you will find all the different programs. You will find birth equity, right?
You will find birth equity, yes.
You'll find, will we find centering pregnancy?
So that would be under the birth equity component of it. So we are offering centering pregnancy at our Kensington OBGYN location.
And that sounds marvelous because, you know, everyone isn't social, but a baby does bring an extra person into your life. So it's a group of women, of moms who are getting ready to deliver, and the whole idea is to support each other because you might not live in a supportive environment, but the whole idea, and this is offered, as Vicky said, at the our Kensington OBGYN office that's located on the campus of ECMC, and the bus stops right in front of it. And so it's again providing support. Social isolationism is real, and it doesn't matter what age you are. If you're 3 years old or if you're 103 years old, there's something, and research shows it. I'm sure all of you know it. There's something to be said about having the company of someone else, just for, even if it's just a half hour a day.
Absolutely.
Yeah. So we just want to make sure that all these programs that she's mentioned, the care management, all of these programs, school-based health centers, is that you?
So I previously I oversaw the school-based health center, so I'm very well versed in what we provide. We are offering we have 7 different school-based health centers that we provide medical care to. So we have nurse practitioners in all of those 7 schools, and they act as a primary care provider. So if you have a child that needs a well visit, and you are connected to one of those schools, you can actually speak to them, sign a consent, and your child can be treated there for whatever it might be. If your child has an earache, they can go down there and they can be treated, and medication can be prescribed, just like you go to your primary care provider. They don't take the place of your primary care provider. You still go to your primary care for your regular routine care. But if you needed a physical for your child, or you needed vaccinations, you can go down to our clinics and have that done.
And at Kaleida, we do believe in vaccinations. Just had to send that, and you can receive a vaccination. We have some exciting things coming up for our employees. You want to talk a little bit about that?
Yeah, so I'm really excited.
Drum roll.
Yes, this is a really exciting, very, very exciting stuff. So when we were looking at the community health improvement plan through the Erie County that we put together as our plan, food insecurity, as I talked about, has been an issue, not just for people in the community, but also for some of our own employees internally. So what we thought in my department was, why don't we help our own employees? Because they are part of our community. They're a very important part of our community as well. So we are very fortunate that we receive funding to provide food boxes for up to 10 employees a week over a 20-week period. So there'll be 10 boxes of food that will be given, and the food box contains enough food to feed a family of 4 for up to 3 days. So the piece that we're really focusing on is also providing that care coordination around that particular, whatever employee, whatever they need, to identify, is there an opportunity that you may qualify, you or someone in your household may qualify for SNAP benefits, or maybe you're not aware of opportunities that are available throughout your community because you're at work, and most of the places are open that you call during work hours. So my team is able to identify that and help you with that. We're doing it very confidentially. So if you're somebody that is struggling with food insecurity or having some difficulty, we actually have a website, an email that employees can go to. And we actually have an offsite location for the food box pickup, because we wanted to make it confidential. So there's nobody knows what you're doing, and we keep that stuff very confidential within our own department. So we're very, very excited about that. The other program that we are starting up is actually a research study. So we were very lucky to be selected by Buffalo Go Green that is actually located right in Buffalo, New York.
Allison Dehoney.
Allison Dehoney, I love her.
Yes.
Love her. And we were selected to participate with them. So we are going to we have information out on our website at Kaleidoscope. That's actually our own email address, our own email site at Kaleida Health, where employees can find out what's going on within Kaleida Health. And again, it's an opportunity for up to 250 employees we were looking for to participate in this. And what's going to happen is if you're somebody that is eligible for this program to join our program, if you're eligible for the program, so if you're somebody that is a pre-diabetic or a diabetic or somebody that has pre-hypertension or hypertension, somebody is struggling with food insecurity, you can apply to be a part of this program. There is going to be distribution of food boxes, and this is very unique, where the food boxes will be delivered directly to your home. You don't even have to come pick them up. They're going to be delivered to your home. And you'll be randomly selected over a period of 8, 12, 15, 20 weeks of food delivery to your house, because remember, it is a research study. And we're also offering cooking classes, which is a requirement of this, so that we can teach you how to cook the fresh fruits and vegetables and other protein things that we're going to have in that food box at a culinary location at DeUville College with a chef, with a clinical dietitian that's going to be working with you. And we require 2 in-person cooking classes, which I think is really fun, because where can you find a cooking class?
Right. For free.
For free. Yeah, for free. And then the other could be virtual if you choose to do that. So kind of, if you're watching like HGTV or one of those Food Network and you're watching them cook, that's actually what you'll be doing as well. So it's going to be a lot of fun, and I hope people really jump on board with this and want to participate.
Now, for the employees listening to the show, because I know we have several who do, where would they find this information on on both programs you just mentioned?
So what we did is yesterday we actually posted this information on
Kaleidoscope.
The Kaleidoscope, which is if you log into your internet from your work computer, it'll automatically pull up your Kaleida Health webpage. It's an automatic thing, and you'll see it on Kaleidoscope, and it gives you the information. And the other thing I forgot to mention is you have to be somebody who is using our Highmark Kaleida insurance,
which I think like 98% of employees are utilizing.
Yes.
Highmark
Insurance.
Employees, yes. And Highmark used to be Blue Cross Blue Shield, but in case you didn't realize when you complete the form, it's now called Highmark, but it's one and the same.
Yes.
Yes. Wow, this is really fascinating. And 20 weeks, you may wonder, what does 20 weeks look like? 20 weeks, as I just counted with my colleague, brings you to the end of October.
It does.
In case you were wondering about food, let's talk about how we're also asking the employees to help each other in terms of in another few days or so that you'll be able to help to donate food towards for the food boxes, because we're kind of focusing on protein, right? Making sure there's enough protein in the boxes.
We are. So so this takes you back to the food boxes for the 10 food boxes that are for people that are struggling and they need the extra support. This was the food box that will feed a family of 4 for up to 3 days. So when we originally wrote this grant, which was almost like, 8 months ago, the cost of groceries has risen. So when we wrote the grant and received it, the food prices have changed. So we want to make these boxes more robust, and we want to make sure that we have enough of those boxes. So we are going to be doing a small food drive. It's not a very large food drive. And asking people, if they choose to do that, if they want to donate to these food boxes to help out their fellow employees, they can do that. So some of the items that we'll be looking for are like a can of black beans, cans of tuna, cans of chicken, pasta sauce, things like that. And we are going to be, we have to be specific on the food items that we're going to have donated, because the food boxes are designed with recipes so that they can extend the food that's in there for the meals for 3 days.
And again, this is not on Kaleidoscope as of yet, but working with the team that develops that. So And one thing we are very intentional, one thing Vicky has been very intentional is doing is to indicate how many boxes, like how many cans of tuna, how many packs of oatmeal. So we won't have, and quinoa. So if you have more, so to apply for the food security pilot, you want to email employee relief at kaleidahealth.org. I'll spell it out. EMPLOYEERELIEF at kaleidahealth.org. So if you're listening to the program and you have a family member who's full-time or part-time, works triple shifts, make sure you also share this information with them. Employee relief at kaleidahealth.org. And if you are, and when they email that, they'll receive information. And again, the goal is to assist 10 employees per week with food boxes on the first come, first serve basis. And each box is designed, again, to support up to a family of 4 for approximately 3 days. And this is a pilot program. So we at Kaleida, we're asking you to support the program. For the listeners who have family members at Kaleida, we're asking you to make sure your loved ones know about this program. Because there are many people throughout, because we're Western New York's largest employer, we know that there are a lot of people who know somebody who works for Kaleida. Anything else, Vicki, that you want to share with our listeners that we haven't covered? You have a couple minutes.
Sure. We're also looking for later in the summer, we're going to be doing a school drive. So that's going to be coming up. That's an exciting time, again, to help our employees at Kaleida Health if they have young children that may need extra school supplies, or if we have community organizations we know that are struggling that may need to be able to supply that to their children.
Or faith-based?
Faith-based, of course.
Mhm.
Yeah, definitely faith-based. So we're looking for that, and that's more to come. And again, if you wanted to get more information, you can email us at that in employee relief at kaleidahealth.org. There's only a couple of us that have that email address, and we will read those emails and respond to help support whatever we can. Again, we're really trying to focus on our own employees as we know that they are struggling. And then we're always looking for opportunities to spread more information wherever we can. Out and about in the community. We also have opportunities to do more screenings with people in the community because there is that 1115 waiver that is going on right now, and it will be in place until until the end of March of next year. And there's a lot of opportunity for people to benefit from that. There's food grocery delivery for people that qualify for that as well. And then, of course, keep in mind that the changes are starting in June of this year with the SNAP benefits. So keep an eye on your loved ones. Keep an eye on, people that have extended family members in the home. Please reach out to us because you may not be aware that you're eligible for things and may be eligible for SNAP benefits. And I recently learned that the aging population, there's a large percentage of people that qualify that don't even realize it. So please reach out. Please talk to people and share this information as best as you can.
Thank you. All right. Well, on that note, I want to thank you, Vicki, for being our guest today on the Great Lakes Health radio program, and look forward for more to come.
Well, thank you.
This is just phase 1.
It is.
Well, there's always a part 2. All right. Thank you. And our guest today has been Vicki Landis, and she is the Vice President of Community Health Improvement here at Kaleida Health. My name is Francesca Messiah, Manager of Community Health Improvement. And in 2 weeks, I will see you again with a very exciting program. Bye-bye. Be safe. Take care.